Two points you cannot miss in the MRCPCH history taking scenario. One of them is very commonly missed by Indian students or overseas students, which is, suppose you have got a child in the school and you are dealing with a communication scenario or a history taking scenario involving asthma or diabetes. Apart from the medical history, you need to find out about what is happening at school, meaning how are things at school, is he performing well in his studies at school, are there any complaints from school, is he missing a lot of school, because legally in the UK if you miss a certain amount of school you can be penalized, and also if he is having any bullying issues at the school as well. This is number one. Number two, also the home situation. Again, in our Indian system of education, very often the medical facts are taken, but we do not inquire about the socio-economic status or whether there's family members, what about their health as well. So first of all, how are things at home, in the sense that to get an idea about the socio-economic status, you cannot ask bluntly, but gently, are you getting along well? Are you managing okay? Or you can ask the profession very discreetly, and you will get some idea. And sometimes, if you probe gently, you will understand that either one of them has been unemployed or is doing long shifts, and they're struggling to pay the finances. And then, if they're on social services or not, so these will come out. Also, about the support systems. So if there is a child who is unwell, suppose a child who's got chronic illness, suppose with cerebral palsy, or a child with cystic fibrosis, or a small child who has got some chronic disorder like again like cystic fibrosis. So is there someone like a grandmother who's around to help, or is there an auntie around to help? Or again, if the parents, do they get along well, or they are going through separation, or they are staying away from each other? These have to be understood very discreetly in the history taking scenario, which for us, obviously, in the Indian situation, we are not familiar with this. So I hope you find these points useful. If you find it useful, please do subscribe and do forward it to your friends. We will thank you for this. Thanks again.